behalf of IIHMR Delhi, it is my pleasure to extend a very warm welcome to all of you. And we are delighted to have you join us today for the launch of AICTE-approved online postgraduate certificate program. This is a significant milestone for us as we are introducing 3 new online programs designed to cater the growing demand for specialized education in healthcare. To begin our event, it is my pleasure to invite Dr. Shuttapa B. Neogi, Director IIHMR Delhi, to deliver the welcome address. Dr. Shuttapa B. Neogi is a distinguished public health specialist and renowned for her leadership and contribution to healthcare. With her extensive experience and expertise, she is actively engaged in research and teaching. Dr. Neogi holds MBBS degree from Niels Ratnasirchar Medical College, Kolkata, MD in Community Medicine from PGI Chandigarh, DNB in Maternal and Child Health. She mentors future healthcare leaders and promotes interdisciplinary research. Dr. Neogi received the Best Women Researcher Award in Public Health, awarded from JISR, and the Most Inspiring Women Leader Award from Trade Flow for her work in fostering healthcare transformation through research. And the Healthy India Health Ambassador Award from Swachh Bharat Trust. Please join me in welcoming Dr. Shuttapa. Ma'am, over to you, please.
Yeah, thank you, Dr. Shikha, and very warm welcome to all of you who have joined us today for this inauguration. Respected Dr. Kajal, Ministry of Commerce, Dr. Ashutosh Sharma, Medical Superintendent, Amrita Institute of Medical Sciences and Research Center, Mr. Siddharth Bhattacharya, the Secretary General of NATHEL, our esteemed faculty, colleagues, and friends. As we all know that the International Institute of Health Management Research, which is IIHMR Delhi, is a distinct institution which was established in 2008 as a management research and academic institution by IIHMR Society, which is Indian Institute of Health Management Research Society, and that was set up almost 4 decades ago. This is the 40th year of the existence of IIHMR as a concept. So since the time IIHMR Delhi was established, that is way back in 2008, and now between 2008 and 2024, we have grown many folds in terms of academics, research, training, and consultancies. We are a growing institute that constantly and continuously strives to achieve the mission and vision with which it was established 15 years back. Our efforts to nurture young professionals and to make them sought after professionals in this competitive healthcare sector has really paid off. Our growth is reflected in the number of students who have graduated from IIHMR Delhi, which is more than 1,300 in number currently. Our growing international collaborations, projects, and global footprints have earned accolades for both the faculty and the students. We have been able to expand our pool of visiting faculty from both national and international sectors. Few years back, we had received some requests from both pre-service and in-service healthcare professionals about the possibility of offering online academic programs by IIHMR Delhi. With this, we had started with short-term certificate programs which range from 1 month to 3 months, and executive programs between 6 months to 10 to 11 months almost 3 years ago. Our faculty members have put in a lot of efforts to define the curriculum, to refine it, and make it more suitable for the industry requirements and make the programs more viable and enjoyable for the students. So in line with the requirements of the National Education Policy, we are able to formally launch the online certificate programs on the basis of our NAAC accreditation. We have obtained approval from AICTE that gives further weightage to the online postgraduate certificate programs. I really feel privileged and honored to see IIHMR Delhi evolving to keep pace with the fast changing requirements of diverse sectors such as public health, hospital, digital health, education sector, and many more. So, on behalf of faculty and staff of IIHMR Delhi, I again extend a very warm welcome to all of you, and we assure you that we will keep contributing to the cause and purpose for which IIHMR Delhi was set up. Thank you, and over to you, Dr. Shikha.
Thank you so much, ma'am, for setting a perfect tone for today's event. Now we move on to understanding the genesis of these programs. I would like to invite Dr. Puneet Yadav, professor at IIHMR Delhi, to share the journey and the vision behind these programs. Dr. Yadav, MBBS MD in Hospital Administration, brings over 35 years of extensive experience in healthcare management and academics. He has provided a strategic direction in hospital operations and quality system for a hospital and multiple healthcare establishments. Dr. Yadav has led quality assurance activities, including NABH audits, and has deeply involved in academic and mentoring postgraduates, graduate, and paramedical staff in health and hospital administration. He has provided governance and health leadership for medical, nursing, paramedical staff in his span of career at various institutions. And he has a strong work ethics and values imbibed from his armed force experience. Sir, welcome, and the floor is yours.
Thank you, Dr. Shikha. Namaskar and a very good morning to our esteemed guests, dear colleagues, and delegates. So I've been given this responsibility, which is rather important responsibility of sharing the genesis of the programs as far as we are concerned. And I look forward to actually taking this journey and sharing with you the perspective as far as the IIHMR is concerned. The story of the genesis of online education is closely linked to the storied history of IIHMR. The visionary approach of the founders of IIHMR defined a vision for health management, education, and training as early as the mid-90s. The concept of health management during this period was clearly ahead of its time, and the IIHMR Society went on to establish Health Management University at Jaipur and two institutions, health management institutions at Delhi and Bangalore, delivering postgraduate and fellow programs in hospital management and affiliated streams. IIHMR Delhi became the fountainhead of providing postgraduate programs, which were on-campus programs in the field of health management education, as well as online programs, training programs, and we've been delivering it through the last decade through our executive programs, the online training and capacity building for government bodies, and management development programs. The healthcare growth story as we look at is healthcare and pharmaceuticals has been recognized as one of the fastest growing sectors in India. The healthcare industry has a compounded annual growth rate of over 12% in the last 5 years. And it is projected that the CAGR is likely to grow between 12 to 15% over the next decade. Recognizing this, the Niti Aayog came up with a report regarding the investment opportunities in India's healthcare sector in 2019. As per the report, the total investment projected for 2022 was approximately 400 billion US dollars and projected to grow by over 12%. The healthcare industry employed 4.7 million people directly and approximately 2 to 3 times that number as dependencies. The National Skill Development Corporation estimates that 500,000 new jobs will be created in the health sector every few years. The WHO on its part on an international level developed the strategy for workforce development by 2030. The strategy advocates drivers in economy, population, and broader areas to enhance the education sector and create a pool of qualified health workers in addressing the labor dynamics in the health sector. The last 5 years have seen an increased workforce in medical, nursing, paramedical, and allied healthcare professionals in the health sector in India, and this requirement is constantly growing. The government of India came out with the National Education Policy in 2020 with a new forward-looking vision for India's higher education system. The NEP envisages institutions to run open distance learning programs and provide lifelong opportunities in learning as a part of their mandate. IIHMR Delhi has a vast experience in delivering high-end professional programs in PGDM, executive, and fellowship. The institute has affiliations with 9 international universities and delivers digital health courses in an online mode along with UNICEF and IIT Mumbai. The institute's public health education initiatives are enhanced by having a field practice area at Goila Dairy for community health training and research, which is itself unique for a management institute. With a strong industry connect through student internships and visits, and participation of the industry as experts as our faculty, and government collaborations in healthcare education training programs, IIHMR Delhi presents itself as a highly professional education institute. So we are ready to take on the challenges and opportunities for delivering online courses in the field of healthcare management, duly accredited by AICTE. We have listed out the opportunities which are present out there, and at the outset, we plan to launch online programs in the 3 streams of hospital management, healthcare supply chain management, and health finance in the current academic year. With our commitment to excellence, IIHMR Delhi looks forward to leading the way in healthcare education. So thank you very much for this. Over to you, Shikha.
Thank you, sir, for your setting the tone. And now moving to the highlights of our the course program. May I request Dr. Altaf to give an overview about our PG certificate program in hospital management. Dr. Altaf holds a medical graduate degree, postgraduate qualification, and PhD in hospital management. And with over 15 years of industry and academic experience, he has specialized in medical nursing administration, clinical operations, hospital planning and designing, supply chain management and quality assurance, and more. He served as an assistant medical superintendent for over 8 years at a large medical hospital and as a senior consultant at State Health Research Center, Ministry of Health and Family Welfare, Chhattisgarh. Dr. Altaf, over to you.
Thank you, Dr. Shikha, for giving me the opportunity. Good morning, respected Director Madam and respected Dr. Kajal Singh and Dr. Ashutosh Sharma, Mr. Siddharth Bhattacharya for joining in the launch of our executive programs. And thank you, Dr. Puneet sir, for giving the good genesis regarding the online program. So I will be sharing the screen regarding the certificate program of in the hospital management program. So I hope it is visible.
Yes.
Yes.
Okay, so this is one of the online program which we are launching. It is the AICTE-approved postgraduate certificate program in a hospital management. It is a 1 year of course, and we have included the modules, and we have the contact program followed by the exam and the offline exam at the institute. And we will be having the industry connects, the visits, virtual tours of the international hospitals and in India also. And this would be see, as far as the certificate program in the hospital management is concerned, right now, from the past 2-3 decades, we have seen how the healthcare industry has grown. There has been a significant growth, and now technology has been driven in healthcare. We are seeing AI is being used in healthcare, digitization, EHR, EMR, and PMJY insurance. They has revolutionized all the TPA sector in the hospital. So there is a demand and an advance and a growth for the skilled managers to navigate the complexities in the administration department. And we are approaching, the India is also approaching the aging population, and the non-communicable diseases are on rise. So there is a great demand of the managers who can manage the hospital, who can impart the better patient care. An effective hospital manager ensures all the laws, ethics related to the patient care and attendance and legal issues and all other things. So he is the best person who can deal with the laws, regulations, and to ensure the patient safety in the hospital. And an effective hospital manager works as a team. He leads the hospital as a team. He works day and night to improve the patient care, to satisfy the patient, to keep the running cost low, and to manage the finances, the budget part, but to maintain the quality of the services. That is the important aspect of the hospital administration. So managers specialized in training in hospital management, they can implement the best practice as far as the running of the hospital, day-to-day operations of the hospital, and imparting the better patient care. There is a need, there is a dearth of leaders, there is a demand of the leaders in the hospital industry who can lead the team, who can manage the team. And every hospital, every organization, they have the vision, they have the mission. To acquire that mission and vision, a leader is required in the organization who can lead the team, who can make the leaders, and who is self-driven, and who can make the decisions. So this program will try to imbibe them the knowledge, and discuss the challenges, the issues which administration faces day-to-day basis, so that he can come up with a solution and he can work for the organization in a better perspective. The target group for this program would be doctors, the nursing, the clinical staff who would be interested, from besides the clinical aspect, they are interested in the management roles. So we have seen in hospitals a nursing staff, when she's getting promoted, then administration work is being allotted to her. Same for the doctors also, they are giving the administrative work also. So those who would be interested, so this program is good for those people. And already those executives, hospital administrators who are working in the organization currently, if they want to enhance their skills and knowledge, and they want to be this is the good course for those people who are already in the industry, and they can be benefited by this course, by this certificate program. And individuals who are having the healthcare backgrounds or allied healthcare background, this is a very good opportunity for them also, because it will get them the knowledge regarding the how to manage the hospitals, how are the services in the hospital, how we should take care of the day-to-day operations, the patient quality, how we can ensure the quality of the services in the hospital. So this course will be beneficial for all those individuals with a background in allied health services. The major focus of this course is thorough understanding of the healthcare system, including the hospitals, the clinics, the other healthcare facilities, and mainly what I was talking, that to equip the executives, the working professional with the management skills, and leadership, because these two skills are very important as far as the hospital administration is concerned. You have to have the management skills in you, and you have to be a leader to, once there is any problem, you have to be a quick decision maker and you have to lead the team. Let us do it. And if there is any, audit, if there is any mass casualty or there is any kind of mishap in the hospital, there are so many things. Hospital is a complex organization. So day to day, there are very new challenges. So this program will try to equip the executives with the skills and how to handle the conflict, how to strategize, how to plan the decisions. So these will be the core course objectives of the program. As far as the course outcome is concerned, this course will, help the give the knowledge and enhance the skills of the executives in terms of utilizing the data analysis tool to increase the hospital performance, to know the basic principles of the hospital management laws and ethics, and policy, how to frame the SOPs, what are the policy frameworks of the department, how we can manage the budget of the hospital, how we can allot the different budgets of the hospital, how an administrator can manage the human resources, a nursing staff, group D employees, paramedical staff, consultants, and how we can enhance the efficiency of the hospital, and how we can increase the services, and so that the patient is satisfied, and brand imaging of the hospital, how we can increase, how we can reach to the people. So all the this certificate program will try to cover the major emphasis and major core areas of the hospital administration. The contents of the program, I am sharing the contents of the program. We have carefully designed the contents of the program, and we have included the hospital planning and design. That is a very important aspect. What should be the architectural design of the services, including clinical, utility, support services, how we can make the proposals, master planning of the hospital, and what is the proper layout, and how we can increase the efficiency of the hospital in a smaller space, how we can, go with the outsource. Some services we can go for the outsource to reserve the space for the clinical areas. Then we have the modules on clinical services, then hospital ancillary services, imaging, laboratory, blood banks, and auxiliary services, dietary, biomedical waste, infection control. Then human resource management is very important it is a very important aspect in the administration. Then logistic and supply chain management is very important to ensure the continuous supply of the consumable drugs and all other vaccines and injection and all other materials in the ICUs and wards. Quality and patient safety is an utmost important parameter. We have included that module. The budgeting and finance management is also very important, and this we have included. Then HMIS and medical legal issues and the project work. So we have the project work also in this certificate program, and a mentor would be allotted. Executive can do the project work in the industry itself where he or she is working, and he can do this. He can do the project work, and the same will be monitored by the mentor from the institute. Total credits for this certificate program is 54. And we have tried to include the major modules in the certificate program so as to give them the holistic approach for the hospital administration. This would be the pedagogy as far as the learning is concerned. We will be discussing the case studies, we will give the assignments, we will have the online lectures, and we can have the industry visits in the hospitals here, and we can have the virtual tour of the international hospitals. We have the 1 week contact program here at the institute, followed by the exams, and we can have the interaction, we can quiz, general clubs, so group also. So this would be the pedagogy. We will try to give the applied aspect as much as possible rather than the theoretical aspect. And this would be the assessment. As far as the attendance is mandatory, because in online mode of education, there has been seen, the person, they don't log in, they don't attend, but attendance, we have kept it very important because it is mandatory that the person is serious about the program, and we have the assignments and project work, which we have discussed, and the term exam. And this is the program flow of the certificate program. We have the registration process, then we have the certificate verification. And before starting the program, we will be having the induction program of 1 week, introduction of the executives and introduction of the healthcare system, hospital industry, health, and hierarchy in the healthcare system. It will be almost of 1 week in the first month. Then we will be having the online classes from 1 month to 10 months. And we will be having the online classes for 6 hours in a week. And I will show the slide of the online classes. And we will also be having the project work, as I discussed. Mentor would be allotted after the 6 months. Then we have proposed the contact program, the offline contact program, followed by the term and exam at the IIHMR Delhi. The duration of that will be the 10 days, so as to interact with them, and they also will give the examination at the institute. So this would be a schedule as far as the 3 programs are concerned. As Dr. Puneet has already discussed, that we are launching 3 postgraduate certificate program in hospital management, logistic and supply chain management, and public health financial management. As far as the hospital management is concerned, the certificate program will commence from September 2024, and we will be having the classes twice in a week, Monday and Thursday from 2 to 5 p.m. And as far as the logistic is concerned, same twice in a week, Wednesday and Saturday. The timings are given. And as far as the public health financial management is concerned, that course will start from January 2025, and we will have the classes twice in a week, Tuesday and Friday from 2 to 5 p.m. And the course fee is also depicted over here. So this would be the class timing, the proper schedule, and when it will be started, and what are the days of the week when the program will be commenced. And these are our esteemed faculty members of the IIHMR, and they have the industry experience, they have the academic experience. Everyone has the unique quality, everyone has the specialization in his own area. So this would be our faculty members who would be part of the executive programs. And we have a very good faculty, and including the internal faculty, we have the visiting faculty also. They are very experienced, and they are the very well trained academicians. So these are the faculty members. Plus, we will be having the industry experts also, who would be taking lectures in different modules in public health, financing, in logistics supply, and certificate program also. So I will hand over my conversation to Dr. Shikha. Thank you very much for listening to me, and I wish you all the best. And over to Dr. Shikha for further proceedings.
Thank you, sir, for giving a brief about your program. Next, let us hear about the PG certificate program in public health financial management from Dr. Pankaj Talreja, Associate Professor at IIHMR Delhi. Dr. Talreja is a master trainer trained by Indian School of Business, Hyderabad, and currently serves as Associate Professor at IIHMR Delhi. He holds a PhD in finance from MIT University, and he earned his PG diploma in hospital administration from Institute of Medical Studies, YMCA, since being actively involved in various national health programs. So over to you, Pankaj sir.
Thank you. Good morning. So this slide, who's operating this?
I have been given the opportunity to move the slides.
Okay, okay. So I think Dr. Altaf has already made my life very simple, So, because the pedagogy and the flow of these programs, I think they have been thoroughly designed, and more or less we follow the same pedagogy. But what is different, if we talk about costing, if we talk about budgeting, if we talk about finance, I think it forms the core of all of our major programs. But we did decide to go in for a separate program, which was the AICTE approved, which is AICTE approved now. And this is the postgraduate certificate program in public health financial management. So what was the need, that why did we actually want to launch a separate program on this, right? So let us come to the need assessment, I think. There's a huge talk about universal health coverage, UHC. So when we actually talk about public health financial management, there was already a request from NHM Odisha, and in collaboration with IIHMR University, we already did a similar kind of program. And we felt that public health financial management is something which is actually very important, and it is kind of scattered in a sense, So the policy making happens at a certain level, it gets implemented at another level, at grassroots level. So probably the program integrates the macros and the micros. So there are global health priorities in terms of universal health coverage. And what this program does is it actually puts three things in places, and it actually tries to put these three things in tandem: the healthcare financing part, the health economics, and the policy making. So this is what we are trying to achieve from this. And we already know from the market that there is a need that how policies are made to how they get implemented. So probably this program will actually cover all this. And we have actually taken up a lot of innovative courses in this program. So we have something which is called as public expenditure review. We have something which is called as fund flow management. We have something which is called as national health accounts. So these were actually unheard courses, right? So, and the idea is that we have to give this knowledge, impart this knowledge, and take the individual from a micro level to a macro level of understanding. So that was the idea going behind this program, the idea to conceptualize this program. So our target group, right? Our target group, so anybody who's actually working in public health space is our target group, right? So universal health coverage these days, it's actually very important. And with that, sustainability is also actually very important. So universal health coverage, it actually requires a lot of budgeting. So the target group here, which we feel it will be very necessary for, would be consultants and advisors. So there are a lot of agencies which work in tandem with the government who actually support this program. As Dr. Altaf was saying, so there is a Ayushman Bharat now, which gets supported at all levels, right? We will be looking forward to these people who actually require this knowledge. So we'll be targeting public health practitioners, health administrators, policymakers. And definitely, since it is a global scenario these days, it is all interwound. So we believe that it will be very good for international health workers also. Now, coming to our course contents, course objectives, as I was telling you. So the core is obviously to enhance the financial management skills, which will actually deal with costing, budgeting, maybe risk pooling, cross subsidizations, and things like that. So the core objective would definitely be financial management skills. But at the end, we would definitely like the participants to have improved decision making, and they could actually think about resource optimization. And I was telling you that probably we are looking at integrating health economics, health financing, and policy. So we would be trying to integrate all these through our course objectives. The outcomes. So what we expect the students to go out with, right? So what we want them to go out would be that they should be good with, so whatever level they are working at. So they can actually see the whole scenario put together. So the idea should always be that at whatever level they are working, they should have the macro level understanding. And that is exactly what our course outcomes reflect, right? So they would go out with a better understanding of PIPs. They will go out with better understanding of budget formulations. They'll go with better understanding of universal health coverage. They'll actually understand how data gets converted into policies. And these are the course outcomes which we are looking at, right? So, and I think following this would be the pedagogy, which essentially again is same as what Dr. Altaf was saying. What we and the contents, right? So let me talk about content. So we actually start with a basic understanding of public health. Then we move towards the health economics concepts, the economic evaluations. Then we move towards healthcare financing. We talk about PIPs, we talk about budgeting, and then we actually move into financial planning and budgeting. Then we actually talk about accounting. So accounting also becomes very important. And eventually, from these basic courses, it moves towards the outcomes. So it actually moves towards health communication, economic evaluation, and inventory management. So the idea is that it integrates health financing, health economics, and public policy. So that is the idea behind this, right? So thank you, Shubha, and back to Shikha. Shikha,
Thank you, sir. Thank you, sir. And finally, let's learn about our PG certificate program in logistic and supply chain management from Dr. Puneet Yadav, sir. Over to you, sir.
Thank you, Shikha, for giving me this opportunity and looking at what the supply chain. So now there was a third domain which was unaddressed till such time, which was the domain of the supply chain management. And when we looked at the need assessment, when we are looking at the need assessment for this, is the first insight that we actually got was the growth of the pharmaceutical sector. We have talked of the growth as far as the CAGR was concerned and how the pharmaceutical sector is growing along with the healthcare sector. So that's one opportunity that has come up. Also, IIHMR Delhi has been holding feedback from the executive programs which we have held in the last decade. And a lot of this feedback from professionals who have been working in the industry was about having a certificate program, a one-year course, where they could get into much more details as far as the management is concerned. The industry insights from management leadership, particularly from the hospitals, the hospital medical directors and other leaders, have stressed on the need for having some kind of a specialization towards healthcare supply chain, because as of date, while there are specialization in supply chain, the healthcare link is somewhere down the line missing. And of course, the health program supply chain, where there are international bodies and national bodies like state governments and all working for a health program supply chain. We've had this very recent conference last year for the Northeast states, where there was a pressing need for having people who have got their expertise in delivering a healthcare supply chain itself. So with that, with the need assessment, when we look at the need assessment, then we look at the next part, which is the target group. Just a second. Sorry for that. The first part will be the target group. When I look at the target group, then I look at the target group in terms of the people, particularly who are working, already got industry experts as far as who are working in the industry, and particularly in hospitals. and such institutions, health institutions, the store officers who deal with the supply chain. Then there are the directors, the medical superintendents, the head of departments of various clinical and diagnostic services who will be transitioning into the leadership role. The chief or the head pharmacists, including the pharmacist, the bachelors who have done the bachelors in pharmacy who would like to get into the supply chain, and of course, healthcare consultant beside the students. The objectives of the logistic and supply chain management program will be, first and foremost, will be effective management through analytics. That's one part which we would like to stress upon in this particular program is the use of analytical tools. The second issue would be the modern techniques in forecasting and in material management is part. Cost containment will be another strategy for building an efficient supply chain. And of course, quality control and benchmarking in health settings. So with these objectives, when we look at the course outcomes, one important course outcome that we would like to bring about is the legal aspects in healthcare supply chain management, because we've had these challenges as far as COVID-19 was concerned, when the challenges of the health supply chain management was really, it got stretched as far as the COVID-19 pandemic was concerned. So the operational and legal aspects is one important area that we would like to have the students to have a knowledge of. Besides using modern operational techniques for forecasting, transportation models in supply chain management to bring in operational effectiveness. The next would be use of analytical tools and techniques. We've had the economic order quantities, the cost containment strategies, the inventory control techniques. All these will require to be informed to the students, and along with that practice, so that they are able to comprehend various tools and techniques and how to utilize them in their workplaces. One feedback that we actually got was cross-dimensional specialized areas, especially in narcotic management, cold chain management, medical equipment management, which is one unaddressed areas as far as healthcare, logistic management is concerned, which is where we look at it. And once they finish the course, they should be able to establish and implement a quality control program as far as the supply chain is concerned. The course content, when we look at, we've got 54 credits, having multiple aspects or modules in that. We start with the introduction, and we first focus on the governance, laws, and regulations, which will include the Drug and Cosmetic Act, the Narcotic Act, the various medical device regulations, the Contract Act, and such laws and regulations which will be relevant in our sphere. The second would be planning and outsourcing. How do we plan and source as far as the supply chain is concerned? So need assessment would be an important parameter, along with the trend analysis and such models. The procurement procedure, the government procurement procedures, the World Bank, and the best practices as far as procurement is concerned. The inventory management and the inventory control techniques. Financial management and the tools for supply chain will be an important paradigm. Then how do we design a supply chain network, where we look at networking tools? And I've already talked of the cross-sectional areas. We are looking at transforming into a logistic management information system as a part of the digital supply chain management and analytics is concerned. And finally, ending quality control and benchmarking with the module. As a program content, we propose to have an industrial project work, which is a kind of a dissertation, which will be done in the sphere where the students are already working, where we will look at a capstone kind of a project work or a dissertation, which will hold 10 credits, which will provide them the necessary skill enhancement and the necessary enhancement of their analytics as far as managing a supply chain is concerned. With that, I suppose the course contents are wholesome, and pedagogy and the other assessment techniques as issues have already been discussed by Dr. Altaf. So I'll not get into those details, but we look forward to delivering this particular course, and I'm sure it will be of great value addition to anybody who comes across and joins this particular supply chain management course. Thank you, Shikha.
Thank you, sir, and thank you to all our course coordinators for this comprehensive overview. I hope that all of you are now familiar with our course background, objectives, and contents of this program. So we now move to the highlight of our today's event, which is the panel discussion. I'm honored to introduce our moderator for today's panel discussion, Dr. Preeta GS, Professor and Research Dean at IIHMR Delhi. She holds an MBBS from Government Medical College Trivandrum and MD in Community Medicine, Community Administration from NIIHMR. With over 2 decades of experience, she significantly contributes to institution's research agenda. Dr. Preeta is an expert in health system research, project management, training, teaching, and she had lead research projects in diverse areas of public health funded by national and international agencies and has widely published. Her previous role includes the position in Ministry of Health and Family Welfare, NIHMW, and UNDP in New Delhi. Now I request Dr. Preeta to introduce our eminent panelists and moderate this session. Over to you, ma'am.
Thank you, Dr. Shikha. Welcome to all gathered here. Today is a historic day in the journey of IIHMR, and today we are very fortunate to have a highly esteemed panel. Let me do a quick introduction of our esteemed panel members. Dr. Kajal presently is the Director in Department of Promotion of Industries and Internal Trade. She is an officer of Indian Administrative Service. She is a unique blend of bureaucracy and clinical experience. A gold medalist in MBBS. She has done MD in Ops and Gynae. She has done an MSc in Global Health Sciences and is presently pursuing Dr. PH in the University of Arizona. And she has, she's from UP cadre, and she has held distinguished positions in UP government as well as at the center. She's extensively published also, and her experience cuts across policy design, strategic planning, and program management. She's skilled in negotiation, budgeting, communication, and both quantitative and qualitative research to deliver impact. She thinks of herself as a global health passionate, CPD certified health and wellness coach. Welcome, ma'am.
Good afternoon, everybody. Good morning. In fact, it's a 12 o'clock time, so we're in the middle. Good to see you all, and thank you, Dr. Sutapa, for having me. And I have been listening to your course coordinators. First of all, let me congratulate IIHMR Delhi for taking up this initiative. I think it's very much required in today's scenario, especially after COVID. And a great job done by all the people who have been instrumental in designing these courses. And I wish all of you a very good, great success in your endeavors and times to come. And thank you, Dr. Preeta, particularly. Feel good to listen to your achievement. Thanks a lot, and I hope that you will have a productive discussions today. And I am also eager to listen to everybody's views. Thank you so much.
Okay, so the second member, thank you, ma'am. And the second member in the panel is Air Vice Marshal Dr. Ashutosh Sharma. He is the medical superintendent in Amrita Institute of Medical Sciences and Research Center, Faridabad. He is a graduate and postgraduate from AFMC Pune. He has a distinguished 37. He can boast of a distinguished 37-year service in the medical branch of Indian Air Force. And during this period, he held various capacities. He was also awarded the Vishesh Seva Medal by the President of India in 2022. So he wears various hats. He's a professor in hospital administration. He's an examiner. He is for MB and MD and NB. He is an assessor for NABH as well as NQAS. and he has special interest in medical support and disaster relief operations. So welcome to you, sir.
Good afternoon, ma'am. Thank you very much. I think at the outset, I'd like to thank IIHMR, the director, all the faculty for getting me onto this panel. I think it's a nice forum to understand what all is happening in the industry, especially on the academic side. With this reputation and demand of graduates from IIHMR, I think this launch of an online programs was a very natural consequence, a natural progression. So I think this is a very great initiative which would have a lot of demand in the industry. And we wish you all the very best. And thank you, Dr. Preeta, for coordinating the whole thing. Thank you so very much.
Thank you, sir. Welcome. And now we move to our third panelist, Mr. Siddharth Bhattacharya. He is Secretary General of Nat Health. He has 25 years of leadership experience in health, technology, and also technology-enabled services. He has worked in different sectors, government, private, multinational, and corporate sectors. He presently, as I said, he leads the Nat Health Secretariat, and Nat Health envisions itself as a competency center par excellence for public-private partnerships. Nisha, please mute yourself. Please, thank you so much. So welcome to you, sir. He has served in various capacities in prestigious organizations. Welcome to you, sir.
Thank you, Dr. Preeta. Thank you, Dr. Sutapa. Thank you to the faculty, esteemed colleagues, and I'm looking forward to this discussion. I'm happy to participate from the industry side as a consumer of a lot of the courses which IIHMR is putting out, and look forward to putting my voice and my views across in this discussion. Thank you so much.
Thank you so much. So we are indeed highly privileged and lucky to be hearing and learning, being enlightened from your perspectives as we are on the verge of launching our online courses. So my first, I wouldn't call it a question, but first point of discussion, I would like to draw Kajal ma'am into this. From a policy perspective, what do you think are the current priorities in terms of skill development for the public health workforce? And how can certificate courses like ours contribute to that? Over to you, ma'am.
Thank you, Dr. Preeta. Yeah, I think a very valid question. And I think from a policy perspective, since we are working with the government, not particularly with the health ministry right now, but I can see overall the priority is to have skill development of our workforce, because we are the young population, and we have a very, we can leverage this towards our achievements and see that our nation can utilize this workforce in a more productive way. Especially coming to your public health side, if I look backward a few years back when COVID happened, and being myself in that position, where I was not in the health department at that time, I was serving the urban development, and since hygiene was a major concern, but at the same time, I believe my workforce did not have enough understanding of how to make decisions based on the data that was available to them. We collected a ton of data in a very short time, and it was really crucial that we could take some data-driven decision making. For example, I was in Uttar Pradesh serving, and being, coming from UP, most of our migrants had moved. There was a mass migration at that time, and we had heard horrible stories of what had happened to those people. So I can tell you one of those decisions that at that time was taken to develop an app by which you can collect the data of that migrants and then see how they can be potentially employed at the places where they would be reaching as their final destinations. So the number one demand that I believe right now for the skill development is regarding this epidemiological and data analysis. This is something I think we can't do without in any department or any sector that we are in. And we really need to be proficient in analyzing our data and see, what are the needs, what are the gaps, and then how do we plug that in. Number two, I believe with the development that I'm seeing that is evolving, and especially in the medical colleges and the hospitals, I'm sure my colleague will give better understanding, but I think this electronic health records and health information systems are very, very crucial, because these kind of skills will improve your delivery and outcomes at the lowest care possible. So that is something, again, I would say another important crucial skill. Thirdly, I believe, very important part is our, we work with the communities, and I found during COVID that how communities were resistant to getting tested, and there was a lot of myths and lot of misinformation going on. It was a terrible time where you don't know who to believe and who not to believe, right? So how do you really manage all that kind of engagement with the community where you have the trust and faith? Because we know the inequities that are prevalent in our society based on religion or caste or anything like poverty. So these kind of skills, I think, to really have an understanding about how to deal with the community, how to win their trust, and how to build rapport, because it's not going to be a one-time thing. You really need to unlearn the knack of, gaining their confidence in the community. So that in community engagement and learning that kind of a research and skill set, because communities really need to be empowered. They need to really own that, ownership should be with them. They should feel, and not just feel, but they should be actually believing in themselves and that they can deal with the scenario, and they should be competent. So our people should be skilled in a way that they are able to handle. And other than that, I believe this environmental health issues, which now are becoming with the climate change and whatever is happening. So pollution and One Health and all these are very new to us. And I think even with the government, a lot of steps are being taken, but we are still naive, and we are not at a stage where I can say there is a comprehensive and a holistic framework of which cuts across interdisciplinary things, and we can really work as one team, whether it is health department or some other department. So there is no kind of convergence I see as of now, where by which we are able to deliver those kind of competencies. These are the major things that I foresee right now. But at the same time, emergency preparedness, responses, your health policy advocacy, leadership skills, communication skills, these also are important. But as you asked for some of the most vital information which should be given to our workers, I believe these competencies should be built in. And with the kind of program that you have launched, this online certification, I think this will be very, very significantly contributing to bridging these gaps that I just talked about. This is a more like I believe when you give online programs, it's more targeted audience. You provide them with the flexibility that they can do it at their convenience, because these are mostly mid-level professionals, and then they have accessible training opportunities. So I believe it really helps them, because not only it will give them a professional recognition, like you put that on your CV and your career is advancing with that, but they stay up to date with the curriculum because they know what is happening. I mean, I also participate, as one of the colleagues said, you learn from each other, you know what is happening in your industry. I'm not always in the health department working directly with them. By having these panel discussions, you learn what is happening, what are the viewpoints, what people are thinking right now, and in which direction we are going. So this kind of program is providing you with a very, very focused skill development. And number two, it is very, very flexible, so that people can do it with their own access to their computers, and their time and flexibility is there. Then as you are doing it, you're making it more practical application, which I feel would be very beneficial for the people who would opt for these kind of courses. And again, the most important thing, which I believe, being also a part of an IS, and I have a circle of IS officer, I have a circle of my doctor friends and all. I think this networking and collaboration with like-minded people, that also helps you to grow in your career and also to contribute to the society at the same time. So this networking and collaboration will also happen at such online platforms. That's it for now. I think we can listen to the others as well.
Thank you so much. That was, that was very informative from a policymaker's perspective, somebody who's in the thick of things. That is good to know, ma'am. Now I'll come back to you. I move to Air Vice Marshal Ashutosh Sharma. So again, from your experience, what do you think are the key skills and competencies that healthcare managers need, and how can the certificate courses help?
Yes, thank you, ma'am. I think that is what we are, during this course and other courses in hospital management want to prepare people for. Practically, we've been talking about it all the time that the hospital manager or the hospital administrator at various levels is basically the go-to person for all activities in the hospital. Unlike many other professionals who work in the field who have a definite cutout task, the hospital manager would be able to do or would be required to do most of the things. He could be a crisis handler, he could be a planner. Planner could be whether it is a small event that talks about to a program development to introduction of a new facility. So what happens is, although the students would be trained in a subject of hospital management, they largely get deployed as generalists in the hospital. At a younger stage, when they join into an organization, they could be given a definitive task of a particular department, could be in front office, could be as looking after the operations at a certain part, could be in business development, could be under finance. But the key point that requires to be done is flexibility. This is one particular, because what happens is that out of the various tasks that we do, the definitive or the technical hard skills are not so much required initially. It's more of soft skills that the person needs to work on. Soft skill primarily, where there should be flexibility, adaptability. The person has to be dependable. The person has to be meticulous. I know these are words which we could apply in most industries, but all the more relevant in a hospital manager's job, where there is not very thing specific that person one single training would do, like a technician, a nurse, or a clinician would go into a particular field, but a hospital manager may have to apply into various fields, or even if deployed in one particular field, would be required to do many more. It's like has to have a finger in every pie. There would be finances that person would be looking after. There would be, as when they come youngsters and they meet after a few years as program managers for a particular department, where they do data analytics, they do business development, they interact with clinicians, they are part of the marketing team, that they need to develop the business of that particular department. I'm giving now more of a private hospital perspective where most of the people would be deployed. As they move up, the resilience means to be able to take any kind of a shock. Middle and upper level managers need to have resilience to be able to adapt quickly, to analyze complex situations which would happen on a day-to-day basis. It is very rarely a kind of thing that a person goes to an office or a department, does his little bit and comes back. It has to be applicable across the hospital. In fact, if you see about 50 to 80, I know it's a very wide range, 50 to 80% of the time that a hospital manager spends is into public dealings, into meetings, into interacting within the hospital, outside the hospital. The percentage of this keeps increasing as you rise higher up in the hierarchy. A younger manager may be required to do 50% interaction and 50% technical skills in the particular department, but as they go higher, it will be more tilting towards that. So as we standard say that the human skills would continue to be throughout, but from technical, you move on to the conceptual skills at a senior level. They have to be able to adapt. Now, towards training in this, I mean, IIHMR with this rich experience in training, but we realize that most of these things we talk about soft skills ends up being a few lectures in soft skills. How do you deal with a high-end clinician who's a head of a department, who's a director of a particular service, and ask him to follow the procedures? How do you interact with the outside agencies where something like, AICTE, Bharat, nodal agencies, where the reimbursements are lesser, the demand is more? How do you develop a program where many consultants would know that this is the way to go forward, and how do you tell them the techniques the optimum use of resources, because it is like telling somebody how to use your tools. So I think a very important part of a hospital manager at all levels will be the soft skills aspect of his ability to learn, his ability to listen, his ability not to respond right there, and ability to analyze any complex situation and come up with something of an implementable solution. So this kind of a training, if we can focus on, definitely as part of a course, we need to give the definitive skills that a person would need, whether it is IT, it is HIS, it is financial management, materials, resource handling, optimum utilization of resources, analyzing new projects for their whether they are cost effective for them to be implemented, comparing alternate projects to see how well the money of a institution can be organized. Very big thing is marketing, as to how much of a money person puts into marketing. Often the management would look to the younger people, to the mid-level managers, to work out objective modality for them to say what is the best use of this particular rupee. So it is varied towards that. So some things we need to train them, and during the internships, ask the students, ask these participants to learn in the particular hospitals. There should be very directed studies that should go towards. But also I feel, because when we take the younger people into jobs, we realize that people who have specialized in one or two aspects, they get a better start as compared to a general, because general would keep rotating. So somebody who wants to get into program manager, somebody wants to go into accreditation, somebody wants to look after the insurance, TPS, and the government panel. So if there is a little focus, so my suggestion could be that during their internship, they should be asked to develop a kind of a specialization, although it's very early for a certificate course, but then that gives his biodata the right fillip to able to get on to this. Plus, when he comes to the hospital, also is kind of utilized more in that particular field. So broadly, this is, and talking about IT and HIS, I think that is like the ABCD or AI, that we have to know. The finance, we have to know. There's nothing like I am a specialist. Specialist has to be in a particular application of a skill. Overall, the manager would be a crisis handler, would be a business developer. So broad, these are my ideas which could be incorporated at their training, at their inductions and their internships. And ma'am, thank you, but a little request that I have a flight to take. So if you permit, I would be signing off on this unless you want to ask me something right now.
Oh, okay. Since you have to go, would you have a message? You touched on various aspects, sir. Most important, what I felt is you said no job is less. Every job is important. Right from a small one to a big one. And you also spoke about the multiple skills that managers should have. Would you have one message for our course participants before you go?
They should be, maybe it's a repeat, they should be flexible, they should be adaptable, and should have the resilience to take on any particular situation. Rest skills we can always read, learn, implement, practice, because the basic knowledge would have been imparted in the course. But once they come into a hospital environment, they have to be open, they have to be ready for gathering new information, the new law that which has come in today. So we can't talk about the older negligence aspects. We have to get in, be more current as to that Nyaya Samhita which has stepped in. So immediately the consultants, the faculty would be looking towards you to be, what does it mean to me? How does it apply to me? So a person has to be ready to absorb new things and then to be able to communicate well to the people. A little aspect more that there is a large amount of interaction with the outside agency, whether it would be statutory, whether it would be governing bodies, or it would be other hospitals where you may be sharing the resources with. So good, grooming and good ability to interact and communicate with all agencies is a very important part of an hospital administrator.
Thank you, sir. Thank you. Thank you so much.
Thank you so very much and wish you all the best.
Thank you so much.
I'll sign.
So I'll now go to Siddharth, sir.
So
Yes.
thank you, Dr. Preetha. I'll make my my comments very brief.
Mhm.
I'm going to touch upon three aspects that I think are going to shape the future demand for healthcare skills. And these are things that at least we see. One is one very important trend that you can see happening with healthcare around the world is the patient is going to be at the, we all know intuitively that the patient is at the center of the healthcare system, right? That's where, healthcare starts from, that's where healthcare ends back. Healthcare, is a system, is a complex system. It requires understanding of clinical skills, ID skills, financial skills, human resource skills, operational skills, infrastructure skills, you name it, right? Policy understanding, policy, regulatory environment. A lot of these skills, while you may be in a certain domain, but an understanding and an appreciation of how other domains work and operate, and the interrelationship on that and the impact on your ability to kind of move out of your domain and interact with this domain presents a pretty large opportunities. All of us know skilling is important, but reskilling and continuous learning is very, very important, right? I think where IHMR is taking this step is allow future healthcare workforce to be upskilled, but while cross-skilled and laterally skilled at the same time. And that's a very, very important step for us to have certainly specialists, but also specialists with a all-round exposure in the way how different facets of healthcare come together and converge towards the consumer. So kudos on that. I think the second important theme I just want to quickly touch upon is the ability to read and interpret data and be able to use data as, as an effective tool for decision making. I think healthcare is gradually or should move away gradually from this is, I read it here or I read it there, to this is what I observe, this is the root cause, and that sort of new skill sets, the digitalization, fast digitalization of healthcare, whether it's the devices, it is technology, it is ABDM stack, that conversion has already started, and there's a plethora of data floating around. And in future, you're going to essentially have machines interpret data, human beings interpret what machines have interpreted. To be able to apply that on the fly is a critical skill set. I'm happy that you are venturing out into the online technology-enabled system, because a lot of the future challenges are going to mean that skills doesn't matter whether it's with one individual or with multiple individuals, the team-oriented skills are going to come into play. And different individuals together may have to solve a problem on the fly, and being able to know who those individuals are across physical barriers, physical locations are going to be very, very key. So that's my second broad theme, use of data in terms of as an effective tool for information. I think the third broad theme is really around healthcare breaking down physical boundaries. I mean, we talk a lot about health being a state subject. Actually, health is a global subject. And here, India has a major role to play with 1.4 billion population. The tremendous asset India has is the doctors, nurses, a huge strength we have. And the rest of the world is aging. The rest of the world is grappling with chronic disease conditions and cities. And to the extent, we train and skill, our true assets, which is the population, with those new age skills, breaking across some of the physical boundaries, whether digitally or physically. Redefining that market is very important, aligning ourselves to what the global requirements in 5-10 years from now is of paramount importance. And there may be new opportunities that will open up for India as a nation. Only few other countries have that sort of depth, English speaking ability, languages, no language barriers. And a lot of that strength is going to come in terms of the education part of what we're able to do for our trained workforce. I'd like to congratulate with those 3 key points. There's a lot I could go on and about, but in the interest of time, unfortunately, I will also have to take your leave. I'm so sorry about it. There's a few guests waiting in the office, who had already come. If there's any question, I'm happy to take.
Thank you. Any questions? Anyone?
If not, all the best. My best wishes to all of you. Thank you so much.
Thank you, sir. Thank you so much. So, Kajal, madam, maybe you can please have the last word here. You spoke about the importance of data for decision making, the role of community, which is very important, for whom we are actually indulging. We are doing everything. You spoke about newer areas like One Health and environment health, in addition to the traditional, importance of traditional concepts like leadership, health policy advocacy, networking, etc. Madam, would you have a message for our new batch? Would you anticipate, one more question I would like to ask, do you anticipate any problems? It would be helpful in your experience. Do you think certificate courses, when we do certificate courses, we have to anticipate certain problems? So your wisdom in that would certainly help us. And I would request you to end your talk with a message to our new joinees. Thank you so much, ma'am.
Thank you, Dr. Preeta. I think it's of course everything has pros and cons, and as we understand, when we meet in person, there is a different kind of connect that we have. We all, I believe personally, having that kind of exposure is definitely 10 times better. But given the time constraints that we all have, we are not able to spare that kind of time to fully be dedicated as an in-person course. So this online kind of a thing is now giving us some respite from that. I believe all of your joinees definitely will struggle with this, that they might have to do their professional commitments at the same time, because I have taken a lot of online courses, and I know you struggle with that you have to submit your assignments, and there are some deadlines which come in between. I would advise all of these joinees to form their informal groups as well, because it definitely help, and you can discuss with each other off the course, and if you have any issues, because many a times they face a similar kind of problem. So that's very, very supportive of each other, and then it really helps you to sail through this arduous task that you have taken upon yourself. So that I would believe is one thing that they should be doing, and that will be a challenge for everybody. From your perspective, I believe that when you are giving online courses, we all believe that everybody will not be as committed as they would be. Some people are just completing it and not putting enough kind of time that should be given. Sometimes the video is on, and your videos are running and you don't actually watch it. So it's important how you really judge their knowledge based on the studies that you provide. Most of the times when I take online courses, and the organizations from where I have taken, they give you very good resource material along with your videos, in which you have additional information. So when your questions or when your assignments are based on that, it ensures that the people have actually read those resources and they've gone through it, which will really help them update with the current knowledge and practices. So I believe it's very it's not very easy also to have this online thing, but at the same time, I believe most of these audiences are very responsible, and they have taken it up, so they are committed to it. But given the time constraints, there will be some sort of escapism in between. So I would advise both sides to try and bring to the best you can, because it's going to be a win-win situation for both sides, because you are imparting knowledge, and once these people land into any professional areas and they show that certification and they are not able to live to the expectations, then it comes onto the reputation of the organization that whether they really imparted the right kind of thing. And the other side is that if they are not committed as much, then they are not learning something for which they had thought they would. It happens. I'm not saying it happens, because sometimes it's all about circumstances. Sometimes things happen which are not in our control. So you also have to be liberal sometimes, giving some sort of a relaxation to the deadlines and keeping that kind of a balance, because these are all employed people, and you really need to see there that you're not very strict at the same time, not very liberal. And the people should also try to, I think Dr. Sutapa wants to say something here. Yes, Dr. Sutapa.
No, there was a question which was posted in the chat box. So one of them had asked that can students pursuing MD who are in their first, second, and third year of PG course take part in this course? And the answer is yes. So I thought that in the benefit of everybody, we should let people know that anybody who has done MBBS is eligible for any of our certificate programs. That's all.
Okay. Yeah, so that's all. I think my final words would be that this is something one should take. It's always good to keep updating your knowledge, and these kind of courses are always beneficial because one, it is like a recognized course, and there are very stringent evaluations, which is giving you a very good understanding of the subject. And also, when you're going into the field, applying it, always remember to have that compassion and empathy, because public health is something you're not dealing with machines and equipments or anything. You're dealing with humans, and they have emotions, and people would expect from you all that you are compassionate and empathetic towards them. So then that's my final word to all. Thank you.
Thank you so much, ma'am, for spending so much time with us, and for interacting with us, and for giving your, sharing your words of wisdom. Thank you so much. We would like to, meet with you again and have these interactions. Thank you very much.
Thank you
And
so much. Thanks for having me, and all the best. Thank you.
Thank you. Thanks, everyone. Over to you, Dr. Shikha.
Thank you, Pritama, and to all our esteemed panelists for such an engaging discussion. We will now open the floor for the question answer session. Please feel free to ask any questions to any of our panelists or speakers. Yes, can we have some questions?
I see in the chat box that there was a question from Sanket Banerjee that only MBBS, I'm a BDS. Am I eligible for this course? Yes, you are eligible for these courses. There's no question about it. And you may like to enroll in whatever course that you are actually interested in. Thank you.
Either you can raise hand or you can write in the chat box. For this,
I think in the interest of time, Dr. Shikha, you can type in your email ID in the chat box, and if anybody has any questions, they can write to you directly. People
yeah, sure.
have questions instantly, but then later on second thought, if they have any queries, they can always write back to you. So maybe just type in your...
Yeah, you can. I have just typed my email ID. In case any of you having any query, any questions, you can write to us. So moving further, although we had anticipated the presence of Dr. S.D. Gupta, sir, the President of Management Board, IIHMR Delhi, he is unable to join us today. However, he has conveyed his warm regards and best wishes to all the attendees. And he's confident that the discussion and insights that we share today will deliver a meaningful progress in healthcare field. So as we are concluding this meaningful event today, it is my...
If I can interrupt, Shikha, there's a query which has come from the chat box. So from Santosh Mishra. If you can just read it out and then the experts can answer that.
Yes, I'm public health master, wanted to enter into hospital administration for this executive course. Can be opinion for me, PG course. Yes, I think he wants to pursue his hospital management program, if I'm not wrong. Or Mr. Santosh, if you want to ask your question, you can ask. What is it?
No, I think the query is that he wants to shift to the hospital sector.
Yes.
And the query is whether executive course or PG diploma course is going to be better. Of the two, which one is going to be better?
Okay.
So our response is that if you've already done public health masters, so the basics of this has already been covered. And at this stage, for you to gain an understanding about the hospital sector, I think the certificate course itself will be a good choice. Because if you enter the PG diploma course anywhere, first year will be a normal course where all the core subjects will be covered, and that you have already covered in your public health master. So it would be kind of a repetition for you.
Any further questions?
Yeah, another question is MHA or MPHA, which will be more likely to have great potential? It's a very tricky question though. So MHA is more specialized, MPH is more generic. The options of MPH are much more because it is a very, it's very broad subject. And MPH is more focused on research as compared to MHA. Now you have to take a call whether you want to go for operations or you want to go for research. If research is your forte or it's your aspiration, then MPH would give you a better choice. If you want to be in the hospital sector only, then MHA obviously would give you an edge over others. Any other queries?
So you can think about the queries, and I have already by email ID. You can send us the queries through email. So as we are concluded this insightful event, it is my privilege to extend a vote of thanks to all those who have contributed to its success. Firstly, on behalf of IIHMR team, we would like to express our heartfelt gratitude to our distinguished panelists, Dr. Kajal Singh, Dr. Ashutosh Sharma, Dr. Siddhartha Bhattacharya, for having sparing their valuable time to join us in today's event. Your insight and experience have provided us immense value to understanding of the current landscape in healthcare and its future directions. We are immensely grateful to SD Gupta sir. He has been a guiding force behind IIHMR's vision and growth. Our director, Dr. Shuttapa Biniyogi ma'am, she has personally supervising the minute details of each activity and has guided the IIHMR team to make it successful. Thank you so much, ma'am. We are grateful to Preeta ma'am for moderating the panel discussion with such an expertise and ensuring an engaging conversation. A special thanks to Dr. Puneet Yadav, Dr. Altaf, Dr. Pankaj for detailing the PG certificate programs. Your presentations have clearly highlighted the strength and uniqueness of our programs. Thank you, sirs. Our gratitude extended to our Dean Academics, Dr. Sumesh, for his invaluable support in launching these programs. And lastly, and very importantly, thank you all the participants for joining us today and making this event a great success. We look forward for your continued support and collaboration. Thank you one and all.
I think we can take a group photo, Shikha.
Yeah, ma'am. If I just request everyone, if you can switch on your video on, please. Everyone. Please switch on your videos. Thank you so much. Thanks for joining us.
Okay, thank you, Shikha. Thank you for everything.
Thank you.
Thank you, Shikha. Thank you, sir. Thank you, ma'am. Thank you, everyone.
Thank you, everyone.
Best.